Welcome back to our channel. Today we're talking about Colicure Syrup. We'll cover its uses, benefits, side effects, how to use it, and how it works. Let's dive right in. Manufactured by Abbott. Colicure Syrup. Uses. Colicure Syrup is primarily used for the treatment of irritable bowel syndrome, IBS, and acid peptic diseases. These conditions affect the digestive system, causing symptoms like abdominal discomfort, bloating, and acid reflux. Benefits. Colicure syrup contains dicyclamine, also known as dicycloverine, which acts as an anticholinergic or antispasmodic agent. It works by relaxing the smooth muscles in the gut, reducing spasms, and controlling excessive gastric acid secretion. This helps relieve symptoms such as stomach cramps, bloating, and pain. Side effects. While Colicure syrup is generally effective, it may cause some side effects. Common side effects include dizziness, drowsiness, lightheadedness, weakness, blurred vision, dry mouth, dry eyes, nausea, constipation, and abdominal bloating. If these symptoms persist or cause concern, consult your doctor. How to use. Before starting Colicure syrup, inform your doctor if you have a medical history of liver or kidney disease, glaucoma, high blood pressure, heart disease, or nervous system disorders. It's important to follow the dosage recommended by your healthcare provider to get the best results. How it works? Colicure syrup works by blocking the action of acetylcholine, which relaxes the smooth muscles in the gut. This helps control the natural movements of the intestines, reduces gastric acid production, and alleviates symptoms associated with acid peptic diseases such as GERD, gastritis, and ulcers.